Today case presentation is on the topic stroke. When coming to stroke, there are two different types of stroke. Stroke occurs when the supply of the blood to the brain is either interrupted or reduced. Brain does not get enough oxygen or nutrients, which causes brain cells to die. When coming to classification of stroke, there are two types: ischemic and hemorrhagic. When coming to ischemic stroke naturally occurs when a blood clot known as thrombus blocks or plugs an artery leading to brain. A blood clot often forms in arteries damaged by a buildup of plaque known as atherosclerosis. When coming to hemorrhagic stroke, in hemorrhagic stroke it is an emergency condition in which a ruptured blood vessels causes bleeding inside our brain. There are two causes mainly due to increased BP or trauma. When coming to ischemic stroke, it occurs due to narrowing or blocking of arteries. About 80% of stroke are called ischemic strokes. The most common ischemic stroke includes thrombotic and embolic stroke. Thrombotic, in the sense thrombus formation. When coming to embolic, the name itself tells the presence of emboli. Thrombotic stroke. Thrombotic stroke caused by inadequate blood flow to a part of the brain due to blocked arteries. When coming to embolic stroke, caused by a clot that travels from somewhere else in the body, usually the heart. When coming to risk factors, high blood pressure, diabetes, coronary artery disease, atrial fibrillation, heart valve disease, high LDL cholesterol, arteriovenous malformations, viral infections are conditions that cause inflammation, such as rheumatoid arthritis. Family history and genetics may also be a risk factor. When coming to signs and symptoms, numbness, weakness in face and arm or leg, confusion, severe headache, trouble seeing, dizziness and loss of balance, unsteady walk, trouble in speaking. When coming to prevention, maintain a healthy diet, exercise regularly, avoid smoking, quit alcohol consumption if you have habit of taking intake of alcohol or having a habit of smoking. Diagnosis: medical diagnosis is of different ways. When coming to right middle cerebral artery infarct, physiotherapy diagnosis: inability to use the left side of the body and weakness secondary to the right MCA infarct. Middle cerebral artery infarct, CT scan shows that bleeding in brain, and ischemic stroke, a tumor or other conditions. MRI, magnetic resonance imaging, an MRI can detect brain tissue damaged by ischemic stroke and brain hemorrhages. Carotid ultrasound, the test shows buildup of fatty deposits, plaques, and blood flow in the carotid arteries. Echocardiogram, an echocardiogram can find a source of clots in the heart to the brain and cause a stroke. Let us see a case study of a female patient aged 70 years got admitted in the hospital with presenting chief complaints of giddiness, fall down, 2 episodes of vomiting, streaks of blood in vomit. When coming to her past medical history, she had hypertension, atrial flutter, cardioembolic stroke. When coming to her past medical history, tablet ecospirin, Stovaz, Epili, Betaloc, and Tresol are the medicines she used to consume daily. Coming to systemic examination, cardiovascular system S1 and S2 are positive, and respiratory system is basal 8 entry positive, and central nervous system is aplastic disoriented. When coming to provisional diagnosis, recurrent stroke. They are first diagnosed as a recurrent stroke. She has a known complaint of atrial flutter, hypertension, cardioembolic stroke. When coming to lab parameters, her hematological test represents that hemoglobin level of the patient is abnormal and all the remaining contents of the blood are as usual as a normal. And also, along with the hemoglobin level, she also has abnormal level of potassium in her blood. Along with potassium and hemoglobin, there are also abnormal levels of SGOT, total proteins, and S protein levels in her blood. So, she is diagnosed as recurrent stroke. When coming to treatment plan, the patient was treated with injection Levipil, levetiracetam, given IV. Following up for 4 days. When coming to Levipil, it is used to control seizures. It acts as anticonvulsant and anti-epileptic agent. Next, when coming to injection pan, which is known as pantoprazole, is given through intravenous route for following up for 4 days. PAN is a proton pump inhibitor which works by decreasing amount of acid made in the stomach. Next one, coming to Zofar. Zofar is an ondansetron. It is an anti-emetic agent. It blocks action of serotonin in brain that may cause vomit and nausea. Next, it is given once a day through IV, following up for 4 days. Next, tablet stowers. Atorvastatin is given through per oral. 80 mg tablet was given once a day, following up for 4 days of treatment. Atorvastatin is a statin class which control lipid levels in the body by preventing action of chemicals necessary for cholesterol formation. It is known as HMG-CoA reductase. Next, when coming to tablets, Strocit, it is a citicoline tablet. Citicoline is a psychostimulant drug. It treats acute stage of cerebral infarction. Next, when coming to injection, Maritol 100 ml was given twice a day through IV, following up for 4 days. Mannitol decreases the cerebral edema. It is known as diuretic. It also helps in reducing the swelling around brain. It helps to make more urine to lose salt and excess water from the body. Next, coming to Hydrocort 100 mg, which is known as hydrocortisone sodium succinate, given through IV route following up for 4 days. Hydrocortisone injection is a corticosteroid. This is used to reduce brain swelling in the patient. If the hydrocortisone, that is corticosteroid, is overdosed, it may reduce the immunity of the patient. When coming to injection, Clexane, that is 40 mg enoxaparin sodium, is given through subcutaneous route. This is used to prevent clotting as it acts as an anticoagulant agent.